Hello, everyone, and welcome. My name is Heather Zessiger. I'm the Deputy Director for the Campus COVID-19 Vaccination and Mitigation Initiative with the American College Health Association. Our project is also known as COVAC for short. And I'm joined by our digital media consultant, Ari Villanueva. And we have the great privilege of speaking today with Nick Moran. He is the Associate Director of Audience Development with the award-winning Communications Department at the Johns Hopkins University Bloomberg School of Public Health. So we are going to quiz Nick on his amazing work and share some of his wisdom with all of you today. So Ari, you want to get started?
Yes, thank you, Nick, for being here. I wanted to start off the first question on basically what drew you to this work.
Sure, yeah. So the work in general, social media, the thing that draws me to it is the ability to really get your message out where people already are. It's different from some other communications networks in that, on social, we are getting our public health messages out to people like while they're also getting their sports scores or while they're also looking at news about yesterday's Kardashian headline or something like that. And so it's a good time to sort of get in front of people at a point where maybe they're not necessarily looking for scientific information, but it's a good little way to get kind of on their radar. So that I like that about it. Regarding the work we do here at the school with public health communications on social media, I think the thing that draws me most to it these days is we are seeing that the approach that we've used over the last 2 years is being more widely adopted by other groups, other public health agencies, other schools, et cetera. And I think the reason for that is because we've shown that it's effective. And so it's rewarding to continue down this path now, because it's like, we never wanted to be the only group doing this strategy. We thought this strategy would work for a lot of people because it's an interesting and novel way to get public health information in front of people. And if anything, we just wanted to see more groups doing that, because if it's working for us, it works for everyone. That's bettering everybody's public health messaging. So we've been satisfied to see, even CDC take some of our design tips these days. We see them replicate some of our designs. So that's really interesting and great.
Yeah, thank you so much. I definitely agree. I love the combination of like up-to-date memes and different topics that are coming up, something that's very visual and that has a lot of, catchy things to say, as well as big, bold letters. I think all of those things are important when you have so much information going through social media at a constant. So thank you so much for sharing that. Our second question, I guess, is more about the team that you have. Tell us more about your team, your experience, and educational backgrounds.
Yeah, so my office, the Office of External Affairs of the school, comprises both communications and marketing, and then also development. And so the overall headcount can be pretty big, but in the context of social media, basically everything you see on our social platforms was touched at a minimum by myself, and we have one social media specialist, so at least 2 people, because that's the fewest amount of people it can take for us to post anything at the school. But because we're in this larger communications and marketing team, some of our content, a lot of our content will be touched by, up to a dozen additional people. So that could range from, like, we have designers on our team who are not necessarily social media designers, but they are people we rely on for design. We have a videographer, we have editors, we have writers, we have all sorts of various subject matter experts that we rely on for technical review, and that ranges from in-house experts to faculty here at the school to, we actually have now the privilege of a couple very trusted, reliable postdocs who we know to go to for certain things. Like we treat them as subject matter experts if it's about, a particular lab science issue that they focus on. So yeah, short answer is it varies. And then we also rely on some external vendor help for more complex projects, and also for, executing a lot of the designs and things that we see.
That sounds like a really great team to work with. Having that many people help out with the stuff. And so as a team, how do you determine what content to develop?
So the past 2 years were interesting because ordinarily in a typical year before 2020, one of the blessings but also challenges of working at a school as large as ours is that we have 10 academic departments in public health, and we have about 120 different research centers in the school, and they are focused on basically any area related to public health that you can imagine, ranging from like bacteriology and malaria parasites to refugee resettlement and road safety. So in a normal year, it is extremely hard for my team to come up with a prioritization list, or like just a basic idea of like, what are we going to even talk about this week? And you know, I don't want to misspeak and say it was a positive, but one of the unique features of the last 2 years was that we were focused on one aspect of public health, which was COVID-19 response and pandemic response. And that focus sort of lends itself to better creativity because you all are starting with the idea of we're all going to be talking about this one thing. It's not I come to a meeting with my priority, someone else comes to the meeting with theirs, and we have to we've already identified what we're going to talk about. And so that's the first step, which has been unique for the last 2 years. And now that we're in this phase of the pandemic, we're trying to take some lessons from what worked there and how we talk about other topics, climate change, gun violence, etc. But basically once you have the topic, so that's the hard part, then it's really just a matter of how I describe it is we come up with a set of key messages, overall ones. So in the context of COVID, maybe one key message could be COVID-19 vaccines are safe and effective. And we want, when we make social media content, all of our content to basically be supporting evidence for that message. So either implicitly or explicitly, each piece of our content is supporting that message. And we kind of view it as though each of our pieces, the message is not necessarily meant to convince anyone in and of itself. The content is meant to convince people of the message. And so most of our content over the last 2 years, especially recently, has been focused around that overall idea. So we come at it from a different angle each time. Maybe one week we're talking about how COVID-19 is dangerous, but the vaccines are safe. That's supporting that message. Maybe the next week it's talking about Operation Warp Speed did not skip any safety trials. That's supporting that message. Maybe the next one is about how vaccines reduce your chance of transmitting, even if you yourself are low risk. That's again supporting this message. So we go like that.
That sounds like a really thorough way to approach everything and really, really good advice to follow for sure. So following advice, what's your advice to anyone doing this work on how best to reach students on their campus?
I think, a lot of the time in social media, the trap you can fall into is you get swept up in scale. And so what I mean by that is someone who might look at a chart, for instance, Pew Research every year comes out with a breakdown of what percent of US adults are using which social media networks. And YouTube and Facebook are always the top. Most American adults are using those platforms. Lower down in raw numbers will be, say, TikTok or Instagram or even LinkedIn or things like that. And I think some people get swept up in scale because they see that and they think like, well, we have to be on Facebook. It's the biggest one. But you need to understand that like within those numbers, there are other demographic, age, geographic considerations of who those numbers represent. And maybe, yes, maybe most US adults have a Facebook account. But when you're talking about students, they're probably not on Facebook. They're probably on one of the others. And so I think the first step for most creators is really figure out where you're going to put your content so that you're in a good position to even meet the audience that you want to meet. And then the second one, which I think is also a trap people fall into, is once you know your platform, you need to also kind of fit that square into the circle of what do I even have to offer them? Like, yes, I know students are on TikTok, but is my team going to like dance in my laundry room while talking about bacteriology? No, we have nothing to offer really on TikTok compared to what we have to offer on Instagram, where we can create content people actually want to see. So that sort of decision making needs to happen before you even create any content. And then once you're creating the content, if it's for students, you really need to take some approaches that you wouldn't take if you were talking to faculty, or that if you were talking to, you know, an older demographic or something like that. And so you need to do more to catch their attention. And the strategy we use is to be funnier, or to even just be more unexpected. We kind of treat a lot of our content, if you can imagine, like a Trojan horse. Like, sure, you might see Mario, but underneath that is like an important public health message that we kind of gave you the sugar first, but the medicine was behind it. And so that's our approach. And I think to that end, I skipped the part of your earlier question about our backgrounds of our staff here. I think that's where it comes into play. Nobody on our team, our core team, had any graduate level public health training at all. We rely on the faculty and the experts we work with for their subject matter expertise. We don't ask them for creative input, and we actually prefer not to show them creative drafts like once we get the script vetted, because we view it as, we'll help you get that message in front of who you want. We're the communications experts. We have people on our team who are artists. We have people on our team who are like novelists, writers. We have a stand-up comedian on our team. Like these are like the core groups that are helping to get the message out. And the faculty are the ones who are telling us the information is correct and worth getting out.
That's so unique that you have a comedian on your team.
Yeah.
Wow. I wanted to go more into the media platforms. So you mentioned TikTok, Instagram. So what media platforms inspire your work? Where do you tend to look for inspiration in terms of, I guess, maybe the comedic aspect or the just things that catch people's eye?
Yeah. So we don't generally look, I mean, we keep an eye on what our peers are doing. And when I say peers, I mean, you know, other universities, other health agencies, but it's very rare that we're taking inspiration from them. It's more just kind of, at least in terms of creative content approaches, we might take subject matter approaches, borrow from them. If we see like everyone's talking about climate change this month, we might want to do something of our own. But it's rare that we see, you know, I won't name any competitors, but like say we see another Ivy League school or something post something, it's probably not different. Like it's probably not something we want to replicate how they did it. For that sort of thing, like what approaches we want to riff on, what sort of like ways we want to, what sort of trending topics we want to address, what sort of memes are out there. That's honestly coming from our own team members' consumption of content on social media, like my own personal use of Instagram or my own personal TikTok use or things like that.
Okay, cool. Thank you so much for answering those questions.
Great. Thank you so much, Nick, for your time. And I've learned a lot from all of this. Ari, did you want to mention your public health work?
Yeah, do you mean with ACHA, or are you saying just in general?
Just in general, I think I meant to include it in your introduction that you're getting your MPH.
Yes. So I'm currently at Emory University getting my master's in public health. I'm a first year and I'm working in health education, communications, and behavioral sciences. So yeah, I'm hoping to, continue health communication work and bridging the gap between design and education and healthcare, etc.
That's awesome.
Thank you both so much.